Thank you for joining us for this March 3rd COVID-19 update. We are joined by the secretaries and doctors of the Department of Health and the Human Services Department, Tracy Collins and David Grace, respectively. And we also have another guest with us today, the state epidemiologist with New Mexico, Dr. Christine Ross. And so, hi, how are you all doing today? We've got some information to share with you, and so I'm going to share my screen so we can go ahead and get started. After they provide their updates, I'll facilitate Q&A with the reporters that have joined us on Zoom. And first up is Dr. Collins. Go ahead when you're ready.
Okay, thanks, Alex. Please progress to the first slide. So yesterday, President Biden issued a directive around vaccinating teachers and making that a priority. And I wanted to read to you a statement from Governor Lujan Grisham, and I wanted to capture some key points of her statement from yesterday. Yesterday's federal directive means, I hope, that a state like New Mexico, which has enacted a hybrid model and worked closely with school districts and charters to aggressively enhance the safety of school buildings and in-person learning environments, can more rapidly get back to full in-person learning. The directive is an indication that the federal government is going to support states in our efforts to get more schools open safely on a faster timeline. Next slide. As before, however, supply remains the limiting factor in how quickly we can vaccinate the many different populations in need. And to that end, we look forward to the support the federal government will provide states with regard to vaccine supply in meeting the goals of the directive. New Mexico, having largely aligned with the CDC ACIP recommendations for vaccine prioritizations, has already been able to vaccinate roughly 14,000 educators and education staff and has scheduled vaccinations for thousands more. Next slide. So I'm just going to conclude there and say that was a statement from our governor. And now let's move on to further updates about the vaccine. I'm really excited to highlight that New Mexico remains #1 in the country for percentage of doses used. So as of March 3rd, around the country overall, 75% of doses shipped have been given. Specific to our state, New Mexico, we have actually given more than 94% of our doses. So we are really doing well. We're leading the country. Next slide. Further highlights and things we should be really proud of. We remain second fastest state for vaccine administration. So we have nearly 23% of our residents partially vaccinated and nearly 13% fully vaccinated. So we have administered more than 609,000 vaccine doses statewide, and we are really proud of our progress to date, and we are leading the country. Next slide. So specifically, more than 80,000 doses of Moderna and Pfizer were received this week. In fact, we received 87,800 doses. And so that is really something that we can be proud of. When we look at Johnson & Johnson, we've already received 17,200 doses. One thing about the production of J&J, they are partnering with Merck, but for the next few weeks, we are not likely to see many doses at all, and then it will ramp up once production is underway. I do want to note that J&J vaccine was sent to providers in 10 counties with the lowest vaccine coverage. So we're really looking out for those counties that have not received a lot of vaccine today. I want to also highlight that we actually have the capacity to distribute more than 50,000 doses per week of vaccine. So the more supply that comes in, the better off we are with getting shots in arms, and we'll make that happen. Next slide, please. I want to highlight that there are 3 vaccines. All 3 vaccines that are available in the US have prevented 100% of hospitalizations and deaths from COVID-19. And all vaccines have been authorized by the FDA. They're safe and effective, and they're very effective against severe COVID-19, all three vaccines. So that's J&J, Moderna, and Pfizer. Next slide. Our vaccine testing and COVID safe practices are really important, and they're going to keep more of our loved ones from being hospitalized or worse, dying due to COVID-19. Please get your vaccine as soon as you're eligible. It could save your life. Next slide. I want to remind you of where to go to register. vaccinenm.org. Approximately 680,000 New Mexicans have registered for the vaccine to date. So please, if you've not signed up, if you're not a part of that 680,000, please register for your vaccine. And I do want to highlight that now on our dashboard, county level registration data is available. And next slide. So vaccine providers are required to give each patient a vaccine record, and this is really important. As we move forward through this pandemic and you begin to get out more, travel, go to different places, you may be required to show a card demonstrating that you've been vaccinated. And what that card will include is the product name and lot number of your vaccine, the date of administration, and whether or not you've had your first or you've completed one of the 2-dose series vaccines, or at least the 1 dose of J&J. It will include the name of the healthcare professional who administered the vaccine or the clinic location. If vaccine providers need more additional record cards, they can email covid.vaccines@state.nm.us. Let me say that slowly. covid.vaccines@state.nm.us. Next slide, please. And this is just a picture of the vaccine card. You can see where your name is, date of birth, the number of doses you received. And so this is an example of the vaccine card that should be made available to you when you get your vaccine. And next slide. I want to remind us all, we've been through 12 months of this pandemic. I want to make you aware of resources that are available. So at the governor's direction, agencies have been collaborating to promote the New Mexico Crisis and Access Line. So connecting New Mexicans to resources and support. So it's available 24/7, and the number is 1-855-NM-CRISIS, 1-855-227-5485. So keep in mind that staying healthy includes your mental health, and be on the lookout for others. So since December 13th, we've had an increase in calls by 22%. And then most callers eventually report lower stress after completing their call. So please make note of this number and do take care of yourselves. And I believe that is my last slide. And I want to now introduce a phenomenal person who I've had the pleasure of working with since I joined DOH, and that's Dr. Christine Ross. Really excited to have her with us today. She's a medical epidemiologist that came to the New Mexico Department of Health in mid-October to serve as the division director of the Epidemiology and Response Division and to serve as the state epidemiologist. She came to us after 8 years with the Centers for Disease Control and Prevention. She was trained in applied epidemiology as part of the CDC's prestigious Epidemic Intelligence Service. And since that time, she has focused her career on global health. She most recently served as the CDC Ethiopia country director and returned home to the United States to be with her family here in New Mexico during the pandemic. So it's a true delight to have Dr. Ross with us today. Can we advance to the next slide? And Dr. Ross, I'm going to turn it over to you.
Thank you so much, Secretary Collins. That was a lovely introduction. I'm so thrilled to be here today. So very happy to have the opportunity to join my family here in New Mexico, and to have the opportunity to assist the state of New Mexico with its COVID-19 pandemic response. So I just have a few slides today. The first one is just sort of a reminder that we know that or globally, we have all been affected by this pandemic. Since this new or novel virus, SARS-CoV-2, emerged from Wuhan in late 2019, this has affected, on last count, 219 countries, and it's really mobilized the world into action. So I guess I just wanted to pause at this moment just to say we've all been affected by the pandemic here in New Mexico, the United States, and really around the globe. And we will all continue to be affected by this pandemic. On what exact level is yet to be determined here in the United States, but we will all continue to be affected until we have global control of this new virus. So next slide. And this is just a quick snapshot of, this is the WHO COVID-19 dashboard. And of those 219 countries reporting cases, there's over 114 confirmed cases, 114 million confirmed cases of COVID-19 that's been reported to the WHO. As of last evening. There's been over 2.5 million deaths. And this is depicted on the graphs at the top part of this slide, and on the bottom, this is situation by WHO region, and the United States falls in the region of the Americas, and we are in the light yellow or gold that you see there on the bottom, and there's been over 50 million cases reported from the Americas to date. So next slide. And now what's happening here in the United States. So this is a snapshot of the CDC COVID data tracker, which I think is quite useful and easy to use. So if you're looking for a data dashboard, I would recommend this one. To date, there's over 28 million cases reported from the United States. And really sadly, I'm sure most of you are aware, we reached a very sad milestone of over 500,000 deaths have been confirmed in the United States as COVID related. And then just the map, I think highlights, I included the map because this highlights the heterogeneity of the epidemic in the United States. And you can see that that there are some differences between New Mexico and what we see happening around us. We're very happy with the progress that we've achieved to date here in New Mexico with all the tools that we have put in place that have been extremely important to control the situation here in our state. Some of our neighboring states are not currently faring as well, and we do hope that we see this turning around for them very soon as well. Next slide. And then lastly, I wanted to just comment that given our progress to date, we know how extremely important it is to ramp up genomic surveillance or surveillance for COVID-19 variants. The table depicts the three variants of concern that are circulating globally and have been detected in the United States as well. And you can see the number of cases that have been reported here in the US and the number of jurisdictions. In New Mexico, we have identified 8 cases thus far of the B117 variant. And I do want to mention that our scientific laboratory division is leading our efforts on surveillance together with our epi and response division. We have been very happy with the progress to date in accelerating the number of sequences or the number of samples that we're sequencing. And currently we are ranked 7th out of 50 states for the percentage of samples that we're sequencing. It's not enough. We need to continue ramping up as capacity allows and as quickly as we can. But currently, we don't have any epidemiological evidence that a variant is impacting our local epidemic at this time, but we will certainly be keeping a very close watch on this. And I think that's my a few slides. So back to you, Secretary Collins.
Okay. Dr. Grace, you ready to jump on? There we go.
I am ready. Thank you very much. Just a couple of quick comments before I launch into my slides. You know, Doctors Collins and Ross and I would say we started the day at 7:30, at 7 o'clock every morning, but I'm sure most of us have a meeting before that, but our daily COVID meeting, and I couldn't ask for two better partners. I really agree with Secretary Collins. We're extremely fortunate to have brought in an internationally experienced epidemiologist, and Dr. Ross has provided numerous insights and updates and given us more of that global and national perspective that's helped us move forward. I've got a slide here on the Johnson & Johnson or Janssen vaccine, and it's just to highlight, as the governor likes to remind us when she's here, that the medical advisory team does do a review of all the new vaccines with a particular eye toward the research, its applicability to New Mexico. We have a lot of confidence in the processes of the FDA and the CDC, but we want to give it that one final review for New Mexico. Our team stayed up late. As you know, we had a very short interval between when the vaccine was approved and when it was distributed, and came up with this recommendation. You could find it online. I also want to say that, you know, we're almost at a year of this pandemic in our state, and what Secretary Collins, Dr. Parahone, and everyone else in the DOH has accomplished with vaccine distribution, to me, is our #1 accomplishment so far as a team in COVID, and the thing we can be most proud of. I think we have made a lot of good decisions and processed a lot of good data and done a lot of very effective interventions, particularly around testing and other things. But our vaccine effort here has been monumental, highly successful, and I'm going to show you a slide that gives you a sense of how successful that is as well. Next slide, Alex, is just a review. I'm sure there'll be a question, or there would have been a question had we not shown this. But as you know, Texas yesterday announced that they're no longer going to have a mask mandate, and they're going to increase all businesses to 100% effective 3/10. Local officials, you know, can do things if they want to, but that's the state's direction. You know, when I read the article, I thought, wow, they must not have a modeling team in Texas if they think this is a good time to do that. But then I did read a quote from the leader of Texas's modeling team expressing not that much confidence in this direction and grave concern. At our 7 a.m. meeting that Tracy and Christine and I were at this morning, we learned that El Paso has the lowest number of inpatient beds than they've had since September right now. Their test positivity rate is 15%, 36 cases per 100,000, as opposed to we're running, in the 10 range right now. And so, you know, CDC further advising states not to end mask mandates. So please don't take your lead from another state. You know, we are modeling this very closely. We know that masks, social distancing, 6 feet apart, staying home whenever possible, keeping your hands clean. We know all of these things work, and we do not believe, let me repeat, we do not believe this is the time to back off on any of those restraints or any of those procedures that restrain the spread of the virus. Okay, so next, Alex. This is our epi curve that Christine's division puts out for us every day. That to remind all of you, we've got the number of cases per day averaged over 7 days on the y-axis, and the blue dotted line is the total state, and the 5 colored lines underneath are our individual 5 regions of the state. A couple things to mention. Number one, we're at 265 cases on a 7-day average, which is good. Number two is that very steep downward slope has resulted in many of our counties going from red to yellow or yellow to green, and even green to turquoise now. And we're really pleased about that, and pleased at all the progress we've made. Some of our counties have become very, very safe places with COVID safe practices, and we're very happy about that. However, if you look at the very end of that graph, there's a little bump, which basically shows, thanks Alex for the pointer, that we've leveled off here. And leveling off means that we're not all riding the same wave from red to yellow and yellow to green, and that things could be a little bit more unstable as a result of that. We don't want to see counties go from green to yellow or from yellow to red, but when this case curve levels off and gets flat, which essentially it is over the past week, that means that the potential for a county with an outbreak to go back to red is much higher. So again, very pleased with the downward trend, watching closely that relatively flat line. And as I say every week, and we do this math every week, we're now basically over 11,000 vaccines a day. We're under 280 cases a day. So for every one person who gets COVID in a day, we're vaccinating 43 people. Absolutely a recipe for success and winning the battle against the current RNA sequencing, genetic sequencing of the wide variety of variants that we're fighting right now in New Mexico. So again, good news, but a little bit of caution that this curve is flattening out. It's also flattening out nationally and internationally. And so we will continue to watch and report to you. Okay, Alex, next slide, please. Just those 3 curves, the green above is cases, the yellow is hospitalizations, pink, red is deaths. Again, 7-day rolling average for all 3. And you can see that leveling we talked about on the top green case curve, but again, a nice steady decline. And report for our hospitals is surprisingly, hospitals still somewhat full, particularly in Albuquerque, with even though COVID cases are way down, Pres and UNM ICU still full, but it has eased a great deal. We are seeing it, we think, a surge in post, in delayed care. So people who didn't see their doctor or nurse practitioner, people who didn't get the follow-up labs they needed, now coming in with more serious complications. So really urge all New Mexicans to get out that list of things to do for your health and make sure you're up to date. I've had a couple different kinds of healthcare interventions, nothing serious, but I had a physical therapy appointment by video. It worked great. I was skeptical about how good that could work, and it worked just great. So please continue to get care. Next slide sort of revisits my new favorite slide. I'm going to show it every week, just to revisit on the y-axis, the vertical axis there, we've got the daily number of cases. Those little round dots are what Lanel uses to peg those exact numbers. The blue line is what our modeling shows us, and we're able to show what our modeling shows us without any vaccine at all. So we're subtracting out that vaccine. Alex can point to you where March 3rd is on the x-axis, the date there. But you can see that those curves, the blue curve is going up, which is what would be happening without the vaccine. And the red curve, which is that same modeling since the beginning of the vaccine, and you can see that red curve emerge right around in late December, has gotten really wide. And you can actually see that distance from the horizontal axis, the x-axis up to the red curve, is about halfway to the blue curve. And what that means, sorry for all the detail, I apologize. Basically what it means is we now feel that 50% of the case lowering that we're seeing is due to the vaccine. So this is more than we were initially expecting. We think it's a good thing. We're delighted to have the vaccine on board now and so many people getting it, because we know that we would see an uptick in cases as we reopen. And so this is a great combination. The vaccine came at a great time. And I think many folks are now enjoying the ability to do a little bit more than we were before. So I think that the difference between that blue and red curve from this point on could eventually be the story of how New Mexico beat the pandemic. And we're very grateful for the vaccine, and particularly grateful to have a third one coming online now. Next slide, please. I think we're now to the gating criteria, and you can see, as we were last week, firing on 7 of 8 cylinders. Our spread rate, pretty close to 1, which you'd expect with a level curve. Testing still robust and adequate. As a matter of fact, there was only 1 county that wasn't doing enough testing last week, and they were only 6 tests short of doing enough to stay below the test positivity rate of 5%. So that's very good news. First time we've had that. Contact tracing, firing on all 8 cylinders, and you can see record low times again, which is to their credit. And also, thankfully, due to the lower case count, we can reach people even earlier and do more thorough investigations. And I've already talked about the green in our hospitals and the fact that they are getting a break and people are getting much needed vacation. So with that, I think I've got one last slide here. If we could go to that, please. Yeah, just a reminder that as Dr. Ross pointed out, the virus is changing. We're keeping a close eye on mutations. We don't know what that's going to mean. We're hoping that the more people we vaccinate and the quicker we get them vaccinated, the more resistance we'll have to these variants, which in and of themselves might be resistant to the vaccine as things evolve. But do remember that we expect this increase in transmission of virus as people get out and about more. Remember that for you yourself and for your family. It's still important to get tested if you have any suspicion or concern that you've been exposed to someone who's positive. If you have symptoms, just another reminder, if you have symptoms, please don't go to work. Please don't go to the grocery store. Please don't go out of your house, actually. Find other ways to get the help you need because that's how the virus is spread. And we probably have at least 6 months ahead of us in this intense fight, but only time will tell that. We repeat these directions every day, getting a lot more calls from people saying, well, now can we have a big mass gathering, or now can we, open up this sort of part of society? And the guidelines are very detailed, very clear, and please make reference to them. They're on the website, and we'll be back next week with a second, our every 2-week red, yellow, green report. So with that, I think I'm going to turn it over to you, Alex, and I believe you're managing our Q&A period today.
I am. Thank you, Dr. Squeeze. Okay, so for the members in the media who are participating, please raise your hand and I will call on you. So give me just a moment to get my bearings and then we'll go ahead and start with the questions. So the first 3 folks I'll go to will be Matt Grubbs with New Mexico PBS, followed by Chris McKee with KRQE, and thirdly, Julia Goldberg with the Santa Fe Reporter. So Matt, go ahead with your question.
Great, thank you, Alex, and thanks to everyone for all the information. Anyone can jump in on this. I'm just curious, as it relates to Texas, over the next weeks and months, what data will you be looking at to give you an indication of whether or not there's a problem, both with border counties like Doña Ana, but also tourism counties like Santa Fe and Taos? Thanks.
Great question, Matt. I'm going to start off. I may turn it over to Dr. Ross. I will add too that the number of publicly available reports on the website from Epi has gone up quite a bit since she's arrived, and she's, I would say, almost nearly as big of a data nerd as I am. And so it's delightful for me to have her with us. You know, Matt, we look at all of the data regarding all the New Mexico counties, and we have mobility data that we can drill down in terms of not just New Mexicans traveling in New Mexico, but people from out of state traveling here too. Taos County is another one, in Santa Fe, and our border counties. Every morning since pretty much the beginning of the pandemic, we've been looking at bed availability in Amarillo, in Lubbock, and in El Paso. And so that data I said earlier about, the El Paso only having 8 beds in the whole city, the lowest it's been since September, is just a daily review for us. We also look at really interesting transfer data every morning to see how many people are being transferred out of New Mexico. In particular, we also can track how many people are transferred in. You know, it makes no sense to assume that our pandemic, as Dr. Ross pointed out, is contained within our borders, because those borders aren't big borders. People travel back and forth to work and school and things like that across state lines. But I feel pretty confident that we not only have the pulse of what's going on in Texas, but can look at that weeks in advance and see the trending. LANL, Los Alamos National Labs, routinely every single week, as long as I can remember, reports on what they're seeing across the Texas border in terms of activity and hotspots in Texas as well. So I would expect we will see more cases along the border, both in Texas, obviously. You know, we think that removal of masks and the public health orders will increase transmission by about 40% in general. So that gives you a number, and I'm going to ask Dr. Ross if she has anything she'd like to add.
You know, Secretary Grace, I think you really covered the topic really well. Would just want to reiterate that we keep a close eye on the borders. Very important, because just as Secretary Grace mentioned, we know that there's movement across state lines, by land, by air, etc. So, but specifically, we're keeping a close eye on Texas, as well as Arizona, Colorado. We have access to data. We can look at their testing rates. We look at their test positivity rates. We look at their case rates. And as Secretary Grace mentioned, we share this data every morning. We discuss it. We discuss strategy. In addition to that, I join frequent calls with HHS Region 6, which Texas is a member of, as well as New Mexico. And then we also exchange information via our state epidemiologist calls. So we try to stay as coordinated and share situational awareness, specifically as it relates to border areas, as much as possible.
Thank you, doctors, and thank you, Matt. Next, Chris McKee, go ahead with your question.
All right, thank you very much. I had a question about Johnson & Johnson, and forgive me, I may have missed this. Do you expect that more vaccine will be coming in related to how much they're giving? So far, I know it was 17,200 doses this week. Do you expect that to be the continued amount that you'll get week by week, or is it going to slow down, speed up? Any indication on what's happening there, and maybe when you may start sending those doses more broadly across the state, because right now it's sort of focused on some of those more rural areas, as I understand it. That was one question. And second question just being, in terms of vaccination in New Mexico, do you have a goal and a time frame of meeting that goal? I know President Biden has pledged to that 150 million vaccinations in the first 100 days. The sort of thought being, if the president set a goal, New Mexico must have set a goal. Do you guys have a goal, a date, and a number? Thank you.
Yes, so thank you, Chris. So to your first question about Johnson & Johnson, we did get 17,200 doses this week. We've been informed that we will not get doses for the next couple of weeks. They're working on production, so we should know more by the end of March. It's the exact number we're going to start seeing moving forward beyond that from Johnson & Johnson. And regarding our goal, we want to get as many shots in the arms of New Mexicans as we can, and it really depends on the supply. So as we see more information moving forward and more long-term, we can project better where we expect to be by the summer. But right now, it's really to get shots in arms most efficiently. Thank you.
Yeah, I might add, Secretary Collins, with your permission, that I think we like being number one. We like being in the top 5. I think the governor is very happy with our performance as a state so far, and I am quite certain would like to see us maintain that position going forward.
Yes, great point.
Thanks, everyone. So next will be Julia Goldberg. After that, I'll turn over to Brandon Evans with KOAT, followed by Steve Edmondson with Socorro Community Radio, and then Matthew Reichbach with New Mexico Political Report. Julia, go ahead.
Thank you, Alex, and thank you, everyone. I have 2 questions, and the first is as follows. Dr. Collins, the CDC is backing a national website called vaccinefinder.org, where providers can list if they have vaccines and which ones. I'm noting some states are publishing weekly lists of how many doses each provider in each county in their state is receiving. New Mexico, at least as of now, doesn't have a public list of which providers are signed up with the state and how much of which vaccine is going where. I was wondering if that information, such as which 10 counties did New Mexico send its Johnson & Johnson vaccine to, and how much, if that information would be becoming part of the vaccine dashboard and public information, and if so, and if not, why not? And then my second question relates to the weekly modeling report, which I thought said that the vaccine was impacting more than 30%. But that's not my question, that's just a comment. My question is, it notes that Taos, Eddy, Lee, and Grant counties have accelerating growth, and a few other counties, such as Doña Ana, have higher per capita case counts, and then it has a note at the end that reads, and I'm quoting, "shift the vaccine strategy toward contagion control in weeks?" So I was hoping someone could explain what that was referring to. Thank you so much.
Okay, yeah, thank you. Keep in mind, Julia, I appreciate your question, that we actually, one of the reasons we're number 1 in our efficiency of vaccine distribution, we have a centralized registration system. So we have a system where we can enter the data, and it's better than Vaccine Finder. So that's one thing to keep in mind. It's called NIMSIS. It's our Immunization Information System, NMSIIS. And I wanted to clarify your second question. Contagion control, was that a comment that you saw? Could you clarify, please?
I might be able to clarify that.
It's a quote from the end of the modeling report from this week. Yes.
Go ahead, Dr. Scrace.
Yeah, on that one I can start, but I think, there's lots of ways to think about vaccines, and there's lots of goals. We could solely focus the use of vaccine on controlling spread of coronavirus. We could solely focus vaccine distribution on protecting the most vulnerable people in our society, in our state. I think our state's approach has been to focus on the latter. I think one of the things about the modeling team is there's a very spirited debate every week about what's the best way to apply vaccine and things like that. And so I think what you're seeing is a perspective from Lionel about that issue. I think that interestingly enough, though, they aren't necessarily different. And if you look at the overlays of the places, the geographic places with the most vulnerable populations, we've got an index for that. And you look at the places with the highest case counts, as we've said many times before, they overlap pretty well. So what we're finding is by accelerating efforts to vulnerable communities, we're actually able to do both. But I don't know, this is more me as an observer of what DOH is doing with the vaccine. Tracy, do you have any other comments on that?
No, you've hit it very accurately. Thank you.
Oh, and Julie, I can't resist. The slide yesterday did say, I think 30%, but we got a call this morning from Lionel that it was more like 50%. So just so you know.
Thank you, everyone. Brandon, you're next. Go ahead with your question.
Thank you, doctors. Yeah, I want to ask a little bit more about the Johnson & Johnson vaccine. I appreciate you talking about the supply. I didn't hear you say specifically where it's going and how it's been distributed, but I do understand that that goes along with rural populations, the ability to not have to keep it at cold temperatures, and the fact that it's only one dose. So maybe talk a little bit about that. But being that the supply is going to be so limited and that we might not know until the end of March how much we get more, how big of a role does this vaccine really play compared to Moderna and Pfizer? Thank you.
So you're right. I don't have the list in front of me, but what we looked at was where we had positivity rates and low amounts of vaccine in the past had been distributed. And that's how we selected a given county to receive vaccine doses, J&J. And, you know, as we look to understanding how much more we're going to be getting, one of the things we have to keep in mind is, yes, with Johnson & Johnson, it's one shot and done. So we can plan, we're continuing to plan on how we'll distribute that once we know how many more doses we'll be getting. And as I pointed out, we won't know that until a few weeks from now.
Thank you, Secretary. Steve, go ahead with your question.
Yes, I have two questions. The first one has to do with sports and particularly cross country. My understanding is that the runners are going to have to wear masks while they're competing, and I was wondering what the science is behind that. When it's, my understanding is it's very hard to get the virus outdoors, and it seems like that's almost unhealthy to have those kids wearing those masks. But I was wondering about the science behind that. And then the other question has to do with the red to green and how you're figuring whether counties are turquoise or green. Union County, they reported 13 cases on February the 23rd, and they had 9 cases that were reported. Now, and I'll get to this in a second, it's a little convoluted. From the 20th to the 22nd, they had 11 cases. They're in turquoise. Now, I was told that it's not when they're reported, it's when the samples are taken. But they were in green the previous period. They were shown as having 0 cases in the last 2-week period. Where are those 13 cases that were reported on the 23rd? Are they going to go into the next period, or will they go back? I mean, I don't know how you're going to figure that. I'm just trying to figure out where these samples came from. Is there a way we can see when the samples were reported? The dashboard doesn't give that. Thank you.
Yeah, let me start by just clipping off a couple of these, and I know Christine and Dr. Dan Sossin have been very involved in this, and so the actual answer to every bit of detail about the red, yellow, green is a longer answer than would fit into the rest of this press conference. But I'll hit some of my points and ask Christine to follow up. You know, the mask science is really solid, and there's no evidence that masks are unsafe. And a lot of us exercise with masks on. We know it's a different experience. People who climb Mount Everest train by exercising with masks on. But we do believe that the outdoors is safer than the indoors, and so you're correct about that. But a bunch of people lined up at a starting line for 100-meter dash, or anytime people pass each other together, breathing hard, breathing heavily, we know can increase transmission. So that is one of the things. I think I get a lot of questions here about, can you prove to me this is unsafe? And we use, every time we have a shred of the medical literature, we use it, but I don't think any of us need proof that the pandemic itself is unsafe. Dr. Ross talked about the 500,000 deaths in the United States. And so I don't think the burden of proof really should rest on proving that anything during the middle of a pandemic is unsafe. We're just using the best judgment we can. And, every sport is a little bit different. And so I think as more counties turn green, we're certainly open to looking at that and changing it. Second thing, before we go to the one county you asked about that I'm going to hand off to Christine, is just to be clear, the difference between green and turquoise is really simple. Green is when you've met the two standards, which is a test positivity less than 5% and 8 cases per 100,000, which is calculated for each county, for 2 weeks. And the report comes out, and let's say you were yellow, now you meet the standard, you're green. If you maintain that for another 2 weeks, you're green. You turn to turquoise. And so it's green. Turquoise is just green after another 2 weeks. There's no other mathematical distinction there. My understanding is that the test results are counted when they come in. And but we, Christine, do you want to add something to that? And maybe I know we are doing. Maybe you could talk about the presentations we're doing around the state too on this topic.
Sure. And forgive me, I don't know that I caught every number you said, but I think the question was related to Union County. And I think what Secretary Scrace just said pretty much summed it up. But just to reiterate, the red to green framework, we are presenting a 14-day average of case rates and test percent positivity, and we want to give a snapshot of what's happening now. So what is that incidence that is affecting the county now? Whereas we may receive reports from a test, whether negative or positive, that may have been done in the past. And we report that data out when we receive it. So there can be some ebb and flow in reporting. So we report it out when we receive it on that external facing or that data dashboard that you can see. But then when we do the calculation for the red to green framework, we don't want to penalize a county with cases that may have occurred in the past, but those are accounted for and those are placed into the state epidemic curve by specimen collection date, so we can understand the evolution of the local epidemic here. But again, we tried to be very careful with that so that we are telling you what's happening now.
So, I mean, just to close up this question, Steve, if we got a bunch of older lab reports from a month ago that showed 30 cases, they would actually not be included at all in the next 2-week report, although they go into our total counts and the data dashboard and the like. So there's just extraordinarily meticulous attention to ensuring that that 2-week snapshot that we produce is actually about the most recent 2 weeks. Okay, Alex.
Yeah, thank you. So before I turn over to Matthew Reichbach, after his question, we'll go to Tessa Mentis with KOB4, followed by Nancy Laughlin with KOAT, and then Brittany Bade with KRQE. Matthew, go ahead.
Hi, thanks for the opportunity. I know Senator Martin Heinrich, he wrote a letter to the CDC asking whether they should focus on just providing the first shots of Moderna and Pfizer rather than and delay the second shots. Just wondering if this is something New Mexico has considered. I know that the White House kind of slapped it down, but also related to the deaths from COVID. Virginia recently added 1,600 backlog deaths in the past couple of days that happened, weeks or months ago. Is this something that can happen in New Mexico or something we should expect? Thank you.
So I'm going to start with the first question. And, we've evaluated what's the most efficient and appropriate approach to vaccine rollout and trying to make use of limited supply. But we are in agreement that we do not want to just give everyone a first shot. We want to complete the series. So Pfizer, first and second dose, Moderna, first and second. Fortunately, J&J, when we start getting more, it's just one shot and done. So we are not aligning with that.
Yeah, and on the death backlog, I've been sort of the person following this and answering all the questions about it. So I'll start. Christine, if you have anything to add, feel free to jump in first. There is a mortality report online, and it's great. It shows an awful lot of detail. So Matt, if you go to the DOH website and at the very top, think it's epidemiologic and scientific reports. It takes you to a link that will show that report, and very contemporaneous. So we got two things going for us. Number one, in New Mexico, we have a single health department. In other states, they have county by county health departments, and I'm not sure what Virginia has. Christine might know. But so we do have fairly uniform reporting. Second, we have some guidelines about reporting deaths to the DOH that in almost every case do get us the data in, I think, a fairly reasonable period of time. There are cases that are referred to the medical examiner to determine cause of death and things like that, but we still keep track of those and report them. So I would be really surprised and stunned, actually, if we found 1,200 or 100 or 10 sort of hidden deaths out there that hadn't been reported. I feel like we have a really good system that we monitor very closely. I don't know, Dr. Ross, anything you would add to that?
No, I do not know any further details about Virginia. And I would say that, we work very hard to process deaths as quickly as we can. It is very difficult to report these out as quickly as we would like, because there is a death certification process that takes some time. So we have been discussing ways that we might further assist the process and expedite the process so that we can keep you all informed and up to date. But absolutely, this is an area, death reporting is a challenging, it's challenging to report everything out in a timely fashion because of the inherent delays and the complicating factors when you really want to be certain that this is a COVID-related death. So it can, in fact, take some time.
Thank you, everyone. Tessa, you are next. Go ahead.
Thanks, everybody. I have two questions today. The first one is regarding schools and the directive that President Biden gave yesterday about teachers. I know that you went over that already. Secretary Collins, I just have some more specific questions about that. And then the second one is going to be about the new public health order and the fine regarding the vaccination process. So first and foremost, to the vaccinations for teachers. I saw the governor's statement. It leaves a lot of a gray area, to be quite honest. It sounds like we're assuming that the federal government is going to help us get that supply boost in order to move teachers into an eligible phase. Is that an assumption, or have you all had conversations with the federal government about boosting supplies so that we can move into that? I guess I'm basically asking for a yes or no if we're going to move teachers into that vaccination eligibility sooner than later. Secondly, with the public health order, we saw that there would be a $5,000 fine for providers or people who are not following those guidelines. How are you all finding evidence of that happening? Are you already starting the process of implementing those fines, or where are we on that? Because that was a very surprising addition to the public health order. Thank you all.
Yes, thank you for the questions. First off, I want to say that we have vaccinated 15,000 plus educators. So I feel really good about that. Keep in mind that we are in conversations with the White House to understand how we roll out this initiative to prioritize teachers, which please also realize that that was the next group in line for us. So they're a priority to us as well. So we're going to work closely with the White House to figure out how to make this happen. Regarding the new public health order, I want to make sure you're clear on the language. It's up to 5,000. It's not a flat 5,000. So it's a little nuanced there, but please keep in mind it's up to. And it's really because we're still looking at limited supply versus demand. And we're seeing that people are doing things outside of our provider guidance And we need to make sure people understand that there are consequences to that, either to the vaccine provider or the person receiving the vaccine. Please be honest and please follow our guidance. And if you have any questions, do reach out to me directly or someone on my team at DOH. Thank you.
Thank you, everyone. Nancy, you are next. Go ahead.
Hi there, can you all hear me?
Yes.
So I know we've covered this in the past, but I'm just, I have some questions because
Oh, we lost.
That was my mistake. Nancy, go ahead. I'm sorry about that.
She's muted.
okay, can you hear me now?
My apologies.
Okay, great. All right, if I know we've talked about this in the past, but if you don't mind just going over this one more time because viewers ask me these questions, if you can just give a synopsis on how the vaccine arrives. The feds each week decide how much is coming to New Mexico, and then how does the state decide how that gets distributed? And then are we losing any vaccines? Have any gone bad during distribution? And then one other question, then I'll stop. But are chains like Walmart, CVS, and Walgreens, are they helping out?
Okay. Yes, so thank you. Regarding the vaccine distribution, what we're doing now is we serve as our conduit where we understand what vaccine providers can do, and then we set up a program to make sure we get vaccine doses to those providers. Now we're also moving this to the sort of looking at equity and making sure that we're distributing, and we're targeting right now counties that have not received large amounts of doses in the past, whether it be because of not having the throughput or not actually having enough people that require the vaccine. So we've been looking at things like case positivity rate in a given county and social vulnerability. And we're distributing and making sure that counties that had received low doses of the vaccine, that they're top on the list to get vaccine doses this week and moving forward. So we're looking at that, and we're constantly evaluating how we address equity, looking at both who's been hardest hit and also looking at making sure we can get doses to various sites and we have enough vaccine providers. So there are several moving parts. And so that is the distribution plan at this point. And we've not discarded any vaccine to date that I'm aware of. I don't know if Dr. Scrace or Dr. Ross want to add to that. Dr. Scrace?
Yeah, just two quick things. A couple steps, I think Nancy might have been asking like from the very beginning. So the federal government lets us know, I think on Tuesday, how many doses we can order. We order those by Thursday. They get delivered on Monday. In general, I think there's been a pretty close correspondence. And I know that at the beginning, we lost a batch of vaccine. I think doses to a rural area where they needed to be frozen. The freezing requirements have relaxed a little bit, so that will help some. But we think we've lost about a total of 200 doses. One at a, like a syringe malfunctions, and which happens, or you don't want it to happen when you're the one getting the shot, but it can happen, and things like that. But we haven't had a batch of vaccine lost since the very first week due to storage or temperature or things like that.
Or vaccine going to waste. I'm not aware of any vaccine being discarded because it went to waste. Right. And that, so that's a good point.
Yeah, we were actually, what I just said, correct? Yeah, I didn't mean to contradict Secretary Collins. We were saying two different things. She wasn't saying 0 and I was saying 200. It's two different categories. And then Tracy, do you want to say anything about Walmart, CVS, Walgreens, and how they're helping?
Yes, they are. So they're a part of the federal pharmacy program. And so this week they got about 17,000 doses. And so Walgreens is completely on board and CVS is coming on board, as well as Albertsons. So hopefully that answered your question, Nancy.
Thank you, everyone. We have 5 more reporters with questions. So before I turn it over to Brittany, I will go to James Barron with the Santa Fe New Mexican after Brittany, followed by Ryan Laughlin with KOB4, and then Kevin Wilson. So Brittany, go ahead with your question, please.
Thank you, secretaries and Dr. Ross. My question is for Dr. Collins. Last week, or perhaps the week before, you said you have a goal of vaccinating 60% of the groups that are currently eligible, which we know is about 850,000 New Mexicans, before moving on to that next group, which of course includes teachers. So how close are we to that 60% goal? And to add on to that, there's only 650,000 New Mexicans registered, which is obviously lower than the 850,000 people who are eligible. So how many of the registered people are in groups 1A and part of 1B that we're doing now?
Yeah, so thank you for your question. So yes, the 60% by group before we move to the next subgroup in 1B is the goal at this point. But keep in mind, we've also been talking about the directive from the president. So we've got to evaluate what's going to happen with those conversations and doses and how that might impact what we're currently doing. And if you think about registration, 650,000 plus have registered, but there are people who received vaccine before our portal was up and running. So it does not include all of those people as well. And so the system is good, but it's not perfect in that we didn't stand it up immediately as we got vaccine doses. And you had a follow-up or further additional question you were asking?
Yes. So of the 650,000 that we know are registered, which is lower than the people who are eligible. So of the people who are registered, I guess how many of those people are in groups 1A or 1B, or how many of those people who are registered are eligible to receive a vaccination now?
Yes, I would have to go into the database and pull that information for you. I do not have it in front of me right now.
Thank you, Secretary Collins. All right, Ryan Patel with the Journal. Go ahead and ask your question, please.
Hi, doctors. Thanks for taking the questions. Dr. Collins, you touched on this a little bit earlier, but I wanted to just see if you can clarify the state's position on first doses versus booster shots. Is it still a priority for the state to give a person their second shot as close to the 21 to 28 day window as possible, or is getting as many people at least partially vaccinated a priority? And then also, could you explain a little bit more about the public health order you talked about and the $5,000 fine? I wasn't sure what you were referring to. Thank you.
Okay, yes, thank you. And yes, it is still a priority that if you receive your first dose, that within 28 days, you receive your booster. The public health order is referring to, we were having problems with either vaccine providers not clearly understanding the guidance, which we did a lot of educating and bringing people up to speed so that they're now aware. But there was also still the idea that people were going out of order without justification. And in addition, we had some instances where people were saying that they were a certain occupation, which would make them eligible for the vaccine, but in fact, they were not. So we have now set up this public health order that we want you to be as honest as possible so that we can make sure we're keeping New Mexico safe and sticking with our prioritization. But if we find evidence of fraud, you can be fined up to $5,000. You could be fined $1, $10, $25, $1,000, up to $5,000 for being found to commit fraud.
Thank you, Secretary Collins. Before I turn it over to James Barron, just a note to the reporters on the line that we have a hard stop coming up, and so please be brief with your questions, and our panelists will try to be brief in their responses as well. James,
Alex,
go ahead.
Alex, if we want to be as brief as possible, I suggest we have Secretary Collins answer all the rest of the questions. And then I'll be forbidden from talking.
Thanks, David. James, go ahead, please.
All right, thank you. I got two questions here, and I'll try to be brief. First of all, Dr. Collins, with regards to time frame with the federal program for teachers with the vaccine, do you guys have a specific time frame where you hopefully can get that worked out and start that process? And then the other question I had is a little bit more broad, but I'm kind of curious from your guys' perspective, since we're coming up to the year anniversary, what have you guys learned over the last year from a professional standpoint about what's happened here with this, as far as how the whole process has gone, and what does this mean for the future for New Mexicans in the state with regards to this virus?
And my apologies, I could not hear your first question.
Oh, my apologies.
Yeah.
No, the first question that I had was just the time frame with regards to the federal program with regards to teachers. Do you guys have an idea what that time frame might be before that program starts to get rolling again?
Well, the goal is March, to have them all vaccinated in March. So working with them this week, them being the president and the office, to figure out about doses and how we roll this out. So that the directive is to complete the vaccination of teachers during the month of March.
Yeah, and James, I'll just comment on the 1 year anniversary. I think you may have reached out. I had a little homework assignment and wrote a little essay about my reflections, and great idea. And we're going to have everybody at HSD do that, our leaders at HSD, and maybe employees as well. But I think if I were going to have some big takeaways, I think the first thing is honestly the leadership of our governor and pushing us very, very consistently to get data, to use data, to have data, to make the data public. I think that has put us in an amazingly good position in the state. A lot of our success in the testing arena, a lot of our success in the vaccination arena, our ability to even do a red, yellow, green on a county level, all kind of come out of that. And I feel like she sets very high standards and pushes all of us. And, as the three doctors at this press conference, working would say, I think I speak for all of us, working for a leader who demands science and demands evidence and demands data is great for us and makes our job, even though it can be challenging at times, it makes it fun to do. I think the second thing I'll say, and then I'll turn it over to the other folks here, is, and this is sort of the Secretary of Human Services hat that I also wear, is just I have been amazed at what a scourge really the pandemic has been to those 1 million low-income New Mexicans that our department serves. We know that people who live in low-income areas have, case rates 4 to 10 times higher right here in New Mexico than those who live in high-income areas. We know that hospitalization and death rates are 2 to 3 times higher for those who get the disease. Just to have to go through that and be under severe economic distress has really been something that's caught my attention and kind of really helped me better understand what my job actually is as the Human Services Secretary, and the really importance of the state having many, not just me, but many advocates for our neighbors who might not even be able to afford a mask or get a ride to get tested and the like. So those are the two of the things I thought about. There's more, but I don't know. It's always good to reflect. Tracy or Christine, what are your thoughts a year into this?
Yeah, Dr. Ross, do you want to go first?
Oh, sure. Well, in a nutshell, this pandemic has been just devastating. So I think I've learned a lot. I think that Secretary Scrace just highlighted one of the most important things we've learned, that inequities are still present here in the United States. And when we look at our data, we disaggregate our data by race, ethnicity. It really highlights a lot of really profound inequities that I hope that we can see improvement in. The other comment I would make is I need to put a pitch in for public health. And I would just say that if we can invest in our public health system, I think it would be really critical. We've done a fantastic job in New Mexico, but there's definitely public health infrastructure and systems that need to be updated and upgraded. and it will really serve us well in the future.
Yes, thank you. And I want to add that to those great points, that we've talked about social vulnerability index and how we have several zip codes, counties that really are very vulnerable with SVIs that are greater than 0.6 on the scale of 0 to 1 for scoring. And I think what we need to also be aware of is that we've done so well as a state to address this pandemic. But if you look overall at our SVI as a state compared to other states, we rank really high on social vulnerability. So we can become a role model for the country on how to do things the right way. And given that COVID has uncovered structural systemic racism and poor funding for public health, that as we move past this pandemic and we understand what we've learned from it, that we also use that to leverage the fact that we really do need to provide more funding for public health. And that is so key. So I thank you, Christine, for highlighting that. It's a great point. I'm just really thankful to see where we are now in this pandemic. And I'm very hopeful for the future that we'll be at a better place in a few months.
Thank you, everyone, for those reflections. So before I turn over to Ryan Laughlin, just to finish us off today, we'll go to Kevin Wilson with the Eastern New Mexico News, followed by TJ Wilham with KOT. And that's it. So, Ryan, go ahead with your question, please.
Thank you. My question is twofold. First has to do with high school sports, particularly Albuquerque Public School District. And the second is what's going on in Texas and possibly considering another travel quarantine restriction for out-of-state travelers, or maybe particularly Texas. First, back to the students. They are looking at trying to get high school sports back, but we know currently they need to go through this hybrid model. I'm wondering, with what we know about the science and the public health for young, healthy people, do we think that the hybrid model is still an absolute necessity to safely bring kids back to school? And if we think that their pod model right now with bringing select students back would qualify as hybrid, and there's a way that we can safely bring kids back to the fields, to their respective sports. My second question is, how effective do we think the mandatory 14-day quarantine was? We had it for a long time. We know some people ignored it. We know some people took it seriously. Wondering how effective do we think that was? And if there's any consideration of bringing it back with what we know is going on with our neighbors in Texas. Thank you.
Yeah, I'm going to take a shot at both of these. I've answered them before in different venues. So on the school sports, it isn't necessarily the hybrid model isn't the magic way of having school sports work. What we're basically saying, though, is the infrastructure that it takes and the discipline around enforcing COVID safe practices and the partitions and masks and distancing and everything else that has to happen to make schools a safe place, and in fact make them more safe than being outside of school for students. It's a significant infrastructure. It requires a custodial staff, it requires administrators, it requires testing, all those things. And rather than proving, that, because, it gets to a point where it's tricky to model like really little details like this. We really feel like that infrastructure needs to be in place that then can support not just in-person learning, but in-school sports as well. And so that's the philosophy we're adopting right now. And I think that what we're going to find is that, and what our early returns on this is, as kids return to school, so far it seems safe, and case counts are quite good and quite low. As we add sports onto that, we're watching that really closely. That just started earlier this week, but if we have a positive experience there, then we'll go on to whatever the next steps might be, and we are in discussions about those. In terms of the 14-day quarantine, we have a world expert here on the value of quarantine. And I know you're talking, Ryan, about the travel quarantine, but just in general, not coming into contact with other people when you might have COVID is actually the way to end the pandemic, and why we do contact tracing identify cases, isolate them, find their contacts. And the problem with folks coming from out of state, particularly if they're coming from a place, just for example, we showed you some numbers today about El Paso. If they're coming from a place across a border that has a case rate that's 4 or 5 times higher than ours, then the probability is 4 or 5 times higher that that person will have COVID than the state where they're visiting, no matter which direction that travel occurs. We struggled to find a way to measure effectiveness of quarantine. Most of the methods we looked at involved online or text messaging or things like that. But as we all know, you can text message from anywhere. And so we never felt like we came across a great metric to verify that quarantine. I think having the rule in place for those of us who like to follow rules works pretty well. And so we believe it had some beneficial effect. And I think if we saw, a differential or border counties seeing a surge or a lot of travel, which I mentioned earlier, we can monitor from out of state to our state from endemic areas with higher case counts. I think we would certainly consider revisiting that because it is an effective tool. There's a balance with tourism, of course, as well. And so I don't know, Christine, anything to add? You can bail me out on this question.
No, you're doing great. No, I would just say that if you're specifically asking about movement into the state, I would say that yes, the quarantine, I think the language has been changed, that it's not required, but it's still highly recommended. In addition to that, we would ask people to monitor for any symptoms and seek out a test. We still think testing is an absolutely critical tool to help mitigate the spread of this contagious disease. So I would say 14 days, and just quarantine in general, we know 14 days is still the gold standard, but we have a lot of evidence that 10 days is a really acceptable alternative option, which we've chosen to put into place here in the state to help balance the extreme burden that we know quarantine places on individuals. I think that would be my inputs on that, but let me know if we answered your specific question.
All right, everyone, in the essence of time, I'm going to go on to Kevin Wilson. Go ahead, Kevin.
All right, thank you. Regarding athletics, I've talked to various athletic directors who feel some of the protocols that we have in place are security theater right now. For instance, we socially distance kids after they just rode a bus for 2 hours together. And in basketball, I understand we're eliminating the opening tip, but those same players are going to guard each other and fight for rebounds. Might some of these protocols be relaxed after we've had kind of a week to look at what looks good on paper and what is actually doesn't make sense on the fields?
Yeah, let me start on that. I've been involved in those discussions, TJ. One is we're operating a lot off of the protocols that were developed by various athletic associations. So I've never heard the phrase security theater before, but just going to go out on a limb and guess it's sort of a term of sarcasm. What we're really looking for is trying to keep kids in New Mexico as safe as we can and mitigate the spread of disease. And that's really the goal. So I can't speak to individual recommendations for individual sports. Today, we're happy to get back with you on this, but we've worked very, very closely with the education community, the athletic community, both at the high school, middle school, and university level to co-develop these recommendations. So we're trying to walk a tightrope really between getting kids more physically active, particularly outdoors, and keeping them, their parents, and us in the state safe.
Thank you, David. And finally, TJ Wilhelm with KOAT. Go ahead, please.
I think he just spoke.
No, that was somebody else, David.
Oh,
I thought you'd recognize my voice by now.
Now I do. Now I do. Sorry.
Dr. Grace, Dr. Collins, and Dr. Ross, thank you so much for taking your time and answering all of our questions. I know it's gone long. This is kind of really for Dr. Grace. Looking at the contact tracing data that was published, I think either today or yesterday, it appears that the percentage of cases, or I shouldn't say cases, the percentage of people who indicated that they had been at a restaurant in the 2 weeks prior to getting COVID, yeah, you've got it. That's exactly what I'm talking about. You see that green line right there has gone up. Just wanted to get your thoughts on that, because that is the time period that Bernalillo County went to yellow, which of course is where the majority of restaurants are. And get your thoughts of, should we be concerned, or with the vaccine being in place, is this not alarming at all?
So TJ, first, I apologize for, I'm taking notes as fast as I can, and I mislabeled that previous one. So I'll erase any memory that was you. The question, we're watching this really closely too. When I talked about, this force of infection being predicted to go up by 40% as people get out and about, restaurants may be, particularly indoor dining, one of the single most vulnerable places to get COVID. So, but at the same time, these curves, and the restaurant one in particular, also represent the fact that a lot more people are going to restaurants now that they're open than they were before. So we try to balance both of those. You'll see that, the grocery or the shopping in general is going up a little bit too as well. And so I think it's a little bit too early to call. It's a percent increase. We have a smaller number of cases, so a percent of a smaller number is a lower number, and we'll know in the weeks to come what that means. And actually, even though you directed your question to me, Christine, or Dr. Rossi really oversees that area that processes this data and tries to figure it out and looks at public health orders and tries to predict what's going to happen, working with our modeling team. So anything else to add, Dr. Ross?
No, I think you covered it, but epidemiologists follow trends. So, right, we're really reluctant to draw any conclusions from that tiny blip up, which could blip down the very next week. But we definitely see it, and we will definitely keep a close eye on it. So that's a very astute observation for sure.
And TJ, I just want to thank you too. Now that I clearly recognize your voice, you've been a good partner with us on this data in particular, and getting us to dive a little deeper. And I just want to recognize you for that, because that would have been, if I'd had three choices on what I've learned in the past year, is how much the media can really help us stay in touch with what the public want to know and what's important for the public to know, so we can translate that into basically online information that people can access themselves. So thanks again for that.
Well, secretaries and Dr. Ross, TJ was our final question for today. So any closing comments before we end?
I just want to encourage New Mexico to continue with best COVID practices and to register for your vaccine. Thank you.
Anything, Dr. Ross, you want to close with?
I would just say there's a tremendous light at the end of the tunnel, but we have to stay vigilant. It's not over yet.
Yeah, and I would just add at the end, while we don't know how long that tunnel is, we're all seeing that light. We're seeing vaccines reduce case counts now, bring to Los Alamos modelers by 50%, tremendously encouraging. There will be a balance between going out again. And I'll just go back like 6 months. This is not an on-off switch. This is not, if your county is green, it doesn't mean return to your previous life. All of the COVID safe practices, everything we've talked about, are what will allow us to open up a little bit, not things we leave behind us as we open. So with that, I appreciate all your time, attention. Again, great questions today, and we look forward to seeing you next week. I think it's the 1 year anniversary on Thursday, and so you'll be getting some information probably soon about our plans for next week as well. Thank you very much, and everybody have a good day. Be safe.